I was diagnosed as having spinal stenosis several years ago. Think of your spinal column as a drain pipe, and inside that drain pipe is a piece of rope. Now, over time, that drain pipe gets clogged. Cartilage, ligament, bone tissue that's overgrown, and it starts squeezing that rope. And then ultimately got to the point where I felt as though I was being pushed with a cattle prod with electric shocks on both sides of my back.
It came out of the blue. I'd worked out that morning as normal on my treadmill and my bike. Everything was great. And then all of a sudden I took a step and I was on the floor.
I was really concerned about her. I mean, because I know how stoic she can be with her pain, but this was really, really terrible. I felt helpless.
I have been working out for 2.5 hours a day for over 30 years. I get up at 5:15 in the morning. It's a very much part of my life. And one day in that yard, I fell down because my leg gave out. And I realized that at that point I had to have something done.
The first 2 hospital ER visits, it was controlled, manageable with medication. But it kept coming back. So something had to be done.
I had a herniated disc, and that showed up on the testing, but what did not show up was this cyst as well, and they were both sitting on a nerve head.
In spine especially, we're continuing to expand our knowledge and continue to expand our techniques and what we're doing. So what we ended up doing with her was an evolution of research technology and research ideas that have come over the last several years.
I was in the hospital a week. I walked out of there, did the rehab, and have been just fabulous ever since. I mean, seriously, I would say it's miraculous.
I was told that if I had suffered an injury that compressed my spinal cord that much, I'd be paralyzed for life. It's only because it occurred over the course of a decade that I wasn't paralyzed.
We no longer need to make big incisions to do common procedures and that help to preserve the normal anatomy and then still allow us to clean out the stenosis part of the problem. That way you've avoided a fusion and relieved all the pressure on the nerves, and with that the leg pain goes away.
I had the surgery, and within 5 days, I was back on this bike.
I think the reason why she healed so well and so quickly was because, we've done a lot of research on the biology of bone healing and also the bone healing involved in spinal surgery.
When I went into medicine, one of my huge goals was to be able to continue to do research, and bench to bedside is, for a clinician, is really the holy grail.
And I think no matter how fancy our instrumentation is or how good our techniques are, at the end of the day, we're partners with the patient in terms of getting them to heal.
You can solve various problems in at least half a dozen ways or more sometimes, and I think the only way to answer those questions is to very systematically and quantitatively look at the outcomes of various procedures and then compare them.
Listening to Sandhu and understanding his background explained to me why his PhD research attitude was infecting and working through all of his clinical work. The research and development piece of this is what makes the boat go forward.
When you get very bright people together and you let them think and discuss and do research together, you're going to get new and novel things. And that's what research is all about.
As I came to the realization that in the future, research is going to have to be conducted with support of the private sector, at about the same time that I had my surgery, the two came together.
Ralph's gift has really allowed me to continue some of the research, trying to make the surgeries we do better so our patients do better.
And I am just so grateful. The fact that we can do something to show our appreciation in what I consider a modest way. We're not kabillionaires, but it's never entered our mind that we would ever want to stop giving a gift every year. Never entered our mind.
Oh my gosh. I mean, what they're supporting and what MedStar has supported and how MedStar has had the vision to see how important and relevant this could be for patients' lives down the road is incredible.
The surgeon fixes you, but you forget that behind that surgeon was all of that research.
Right. There's a reason why we do this, right? Every successful patient we have is a reason to go a little harder, to work a little harder, and to focus on what's important.
Raise the flag and let you be seen. Lead the charge.
We are incredibly inspired by their gratitude, and that will continue to motivate us to do everything we possibly can to make the lives of our patients better.
The researchers, we appreciate everything you do, and thank you a million times.